If you sell All-on-X treatment, let me know if this sounds familiar. You're halfway through your consultation and you realize your patient is not with you anymore. Most people will not say, I'm lost, I'm confused, I'm anxious. Instead, they're going to quietly check out. They're going to nod without asking questions. They're going to glance at their spouse. They're going to stare ahead. When you see this, they are no longer processing what you're saying. They're just coasting to the end. And the coasting patient almost always says, I need to think about it. This is where my pit stop method is going to come in super handy. This is how it works. Think about a long road trip. You would not drive for hours and hours without stopping for gas and refreshments. You'd run out of fuel or energy before you reach your destination. Consultations are the same way. They're very taxing. So if you try to get through your entire presentation without stopping regularly to refuel, your patient runs out of mental energy and they stop listening. So every few minutes, just make a pit stop. I've covered a lot there. How's that sounding so far? Does that make sense, or should we slow down on anything? On a scale of 1 to 10, how clear is this process for you right now? Do you need clarification on anything? These pit stops refill their tank with understanding, confidence, and trust. If their energy is still high, by all means, keep driving. But if you see hesitation or they gloss over, just stop and check in. And if you notice they're overwhelmed, call it out. I can tell this is a lot to take in. What parts would be the most helpful for me to go over again? Because the goal really isn't to finish your presentation in record time. It's to arrive at a destination where your prospect actually feels comfortable and confident saying yes. So watch their body language and use a pit stop if it seems a little bit off. You never want a patient running out of fuel before the close. Full Arch Doctors and TCs. Like, follow, or subscribe for more tips on closing high-value full arch cases.